I am Richard Tetefoli, and today I'll be talking about care of a colostomy patient. Okay, to start with, you always have to wash your hands and put on disposable gloves. The things needed for the care are disposable gloves, one, a bedpan, bed protectors, a pouch or colostomy bag, and bed cover for the patient, and a belt. Depending on the pouch you use, that comes with adhesive or belt. First off, you have to protect the patient's privacy, so you get a bed cover and you cover the patient. Next, you place bed protectors underneath the abdomen area of the patient. Then you put a bedpan also underneath it in order to take up any spillage of the stool. Next, you carefully remove the pouch. If it's a disposable or if it is a type that has an opening, you carefully drain it out. After removing it, you place it in a plastic bag and properly dispose of it. Next, you have to clean up the surrounding area of the stomach and check for any abnormalities, injuries, or swelling. Next, if there's a reddening, you also have to note it down and report it later on. Next, you take a tissue paper and clean it in a circular manner, avoiding direct contact with the wound. You clean it carefully. Afterwards, you use soap and water and clean it. Pat dry afterwards and use skin lotion if required. Next is to place back the pouch. If whatever type you're using, you place it back. You make sure it's sealed tight, and you carefully ask the patient if he has any discomfort or any problems with it. If not, then you continue with covering the patient up, then taking off the bedcloth. Next is to dispose of anything that was used, like the plastic bag, the tissue papers, and the bedpan and the bed protectors. Another thing to note is that the stool must be checked for any abnormalities like blood and must be reported immediately as and when it's noticed.